The public weighs in on key topics, and some GOP members weigh in on health insurance concerns in this week's Capitol Report. Hello, everybody, and welcome to Capitol Report. I'm Julie Bartke. The event that draws millions each year is also a tool for gauging public opinion on some hot-button issues. The Minnesota Senate and House of Representatives once again have opinion polls available at their respective booths. The polls' questions typically reflect issues that the legislature expects to address in the coming session, and they can be controversial.
We have a question regarding the shutdown in terms of allowing people the opportunity to choose the similar situation of Wisconsin where they do not allow a shutdown. You go by the previous budget. Another one, the Viking Stadium question, is certainly generating a lot of questions, and those for, those against. And then also we have a healthcare question, and again, kind of the similar viewpoints as we've seen in past years, in terms of those that like the federal system, those that do not like it.
You know, a lot of just budget questions, I would say. I think people are mostly concerned about their taxes going up and the spending and just getting a handle on that. And, you know, people have really said they're concerned about the debt that we're putting on our kids and our grandkids, and, you know, upset about the fact that it seems to be getting out of control. So.
And as a legislator working at the booth, how much weight do you put into what you hear from constituents, even if what they are expressing, even if the majority of what they express might not be in line with your views?
Yeah, that's a great question. You know, I think as a representative, we should be listening to our constituents and listening to the people, and that's what we're the people's representatives. But, you know, as far as getting elected to our positions, I think that we come to the people with, this is what we believe, this is how we want to see things change, this is what we want to do. And so, you know, I take both those things into consideration, but, you know, I'll probably continue to vote the way I said I was going to vote, and the people elected me to do the job that they elected me to do and to stand on those principles.
As the Federal Health Care Reform Act continues to move forward, various components continue to draw criticism by some. These GOP lawmakers oppose a recent decision by Governor Mark Dayton to accept a $4.2 billion grant to develop and implement a health insurance exchange. That exchange would allow free market-style purchasing of health insurance. The governor's decision to accept the grant for this purpose brought forth some strong words.
We want to make it clear again to the administration that we believe that they are exceeding their authority to act in this way. We had a hearing earlier in the year in our committee where we asked the commissioners of Health and Human Services as well as the Commissioner of Commerce who were there to work with the legislature. If they were going to pursue the enactment of a federal exchange, that they needed to work with the legislature. They need to have the input of the people of the state of Minnesota, and that happens through the acts of the legislature. They have not introduced anything to the legislature. They have not communicated in any way with us on anything, but they have taken the position, apparently, by this action this last week, that they are going to unilaterally do this. And we believe that they do not have the authority to do so, and we're going to pursue every means available to us as a legislature to prevent that from occurring.
I worked really hard to get here because I thought the way this worked was the people gave input on ideas. And what appears to have happened in this case is Minnesota taxpayer dollars get sent to Washington, sent back with lots and lots of strings. The rules that Kathleen Sebelius has put around this plan are unbelievable. And now, even after we had a hearing and asked the Commissioners of Health and Human Services and of Commerce to please get our input before they charge down a path, they're ignoring that request.
Here to talk about the creation of a health insurance exchange, we have the chair of the Senate Health and Human Services Committee, David Hann. Thanks for joining us today.
Good to be here.
So, Senator, we just showed the press conference from a couple of weeks ago, and as you mentioned there, you don't believe the governor and his cabinet have the authority to unilaterally move forward with the Health Care Reform Act and the creation of this insurance exchange without input from the legislature. So a couple of weeks have now passed.
Right.
Has anything moved forward since then or changed?
Well, a couple of things we've been doing. We've been looking at the federal rules and also at some of the provisions in the state statutes and Constitution because we are concerned about what the governor is doing. We think that this is not the way to pursue this, frankly. We think there's a question about whether we should pursue it at all, but if you are going to pursue it, we don't think this is the way. So we have been doing some research on various questions related to this, and we are contemplating holding some hearings in the next few weeks.
Okay, and as you are talking about the creation of this healthcare exchange, you don't think that that's the way to pursue it. What, in your opinion, is the way to pursue it?
Well, I think that if you are going to implement a healthcare exchange, you need to have the legislature take action to do it, and that sets aside the question of whether or not we should have one, which I think is an important question. I'm not persuaded that we need to have one, but if you are going to do it, I think you need to have the input of the legislature. You need to have testimony from the people who are affected. You need to establish what exactly you think is going to happen when you do implement this exchange and what you think the outcome will be, and we haven't done any of those things.
Okay, Commerce Commissioner Mike Rotham has said in preparing for this exchange that, quote, "We will actively seek constructive public input from all parties. We need all hands on deck, consumers, employers, legislators, insurers, agents, navigators, and healthcare providers to help design the exchange that supports Minnesota's unique healthcare system and demonstrates again why Minnesota leads the nation in healthcare innovation." This presumes that he will be seeking your input and that of the legislature. Is that a fair presumption?
Well, I would expect that they would. In fact, we had a hearing earlier this year during the regular session, and we made it very clear that we expected the executive branch to work with the legislature on anything they were doing. They were very, excuse me, in my opinion, evasive about their intentions at that point, and it seems to me right now that they've decided to pursue this unilaterally, which is consistent with what they've told me in private conversations, that they think that they don't need to have the legislature's involvement to enact this, which we disagree with.
Has the legislature started, and you in particular, started forming a plan on how to weigh in outside of hearings?
Well, what we want to have is some hearings, and we've seen some of the documents that have been produced, and we are going to pursue the things that are in those documents and ask for clarification on the part of the commissioners on what they're doing, who they've been talking to. There have been no proposals that the administration has given to the legislature. There were no bills introduced to form an exchange. There's been nothing formal, and in fact, from my perspective, nothing informal from the administration on this issue. And we think that, again, it seems to me that what they are doing is working in concert with the federal administration in Washington to bring something to Minnesota that is presumably going to be presented to the public and say, here it is, take it.
So, Mr. Chair, let me ask you, 6 states so far have enacted health insurance exchanges. 2 of those were predated to the health care reform. Are you prepared to look at what these states are doing to see maybe what might work in Minnesota?
Well, we've looked a little bit at both what Massachusetts has done and what Utah has done. I think those are the 2 that have put in place exchanges prior to the federal law. And they're very different, of course. The Massachusetts approach is probably very consistent with what the federal model envisions. The Utah approach is quite different. I think the question that should be asked and answered before you proceed is, what is the intent? What is it that we think we're going to accomplish by putting in place an exchange? What is the expectation? And have some way of measuring those results. If you think that you're going to get lower cost or better outcomes, then those things ought to be defined and put and talked about, and we ought to measure those going forward. That is not clear to me what the intent is here by the federal law and what the intent by the administration is, and it's something that we need to understand before we pursue this.
Senator, off camera prior to this interview, we were chatting a little bit about the state fair, and you had said you were out there previously, last week I believe it is,
yes.
And that you had heard that the Senate opinion poll was getting a pretty good turnout this year. So I want to ask you a little bit about one of the questions on the Senate State Fair opinion poll, and it does address health care. It asks Minnesotans to weigh in on whether they believe the state should remain in control of health care or whether the state should implement the federal health care program. So how much weight will you, as chair of the HHS committee, give these results?
Well, we're going to be interested to see what people think. I'm hopeful that people will express the view that they would prefer to have local legislators and government pursue healthcare questions rather than federal government. It's always preferable to have government closer to where the decisions get made, in my opinion. That way, if something isn't working, you can change it relatively quickly. If we put in place this federal healthcare structure and it's not working well, it's going to be extraordinarily difficult to change it. We think we're much better off if we're going to do healthcare legislation to do it at the state level And that way, if there are problems or things that need to be done differently, we have a better opportunity to do it.
And if the majority of Minnesotans disagree with that, will you take that into consideration?
Well, I think we'll take it into consideration. What it'll tell us is that we need to do some more work at trying to educate or explain or understand what the opinions are. Sometimes when you have opinion polls, they may not be as expansive as you'd like, but we'll keep working at it.
And Senator, the committee, HHS committee, will change dramatically next session. Senator Linda Berglund has stepped down. Senator Tony Laurie will now be the new lead minority member on that committee. What do you think he's going to bring to the table?
Well, Senator Laurie is, I think, a very energetic representative senator. I've known him and been on the committee with him in previous years. I have great respect for him and the work he does. I think he brings a certain passion to some of the issues that the HHS committee deals with, and I look forward to working with him very much, and certainly we'll all miss Senator Berglund.
And one last question, as we look ahead to next session, what are some of the key issues, policy issues in particular, that you plan to take on?
One of the things that we're looking at right now is something called a healthcare compact, which some of the other states, I think there are 4 other states that have adopted. We're doing some research on that issue. We think that we may bring that forward in the next legislative session. What that would do is create a structure that would allow the states to have direct control over the spending of the monies in healthcare. And as we said before, we think that is the direction we need to go, and that is a mechanism that seems to be workable, and we're going to explore that.
And I'm certain we'll have you on the program plenty of times next session to discuss these issues. So again, and as always, thank you for joining us. We appreciate your input.
Yeah, glad to be here.
The 10-year anniversary of a tragic moment in our nation's history is quickly approaching, and this group wants to remind people that the nation came together after the September 11th terror attacks. These religious leaders plan to commemorate the day with an event at the state capitol.
I hope for something more out of this event. As a religious community organizes the community broadly for this, I hope people understand this is something that's not simply looking backwards at a historical event, but this is going to be a statement about who we are as a country religiously that has something, I think, to teach the rest of the world.
Sometimes people wonder, why do memorials matter? Why does that remembrance matter? And I think it's something that's really an interesting part of the human fabric. You know, what you see behind me are those folks that oftentimes first responders don't see. People call first responders, police, fire, EMS, when things are going wrong. And the encouragement that our first responders get when the community comes together in a way that you're coming together is a tremendous boost to them.
The retirement of longtime Senator Linda Berglund resulted in an important opening on the Senate Health and Human Services Committee. Tony Laurie will fill the seat as the lead minority on this committee. We caught up with him at the State Fair to get his thoughts on his new position. Senator Laurie, first of all, thanks for joining us today.
Absolutely, always a pleasure.
With former chair of the HHS committee, Senator Berglund, stepping down, you are now the lead Democrat. What do you hope to bring to the committee and to that role in particular?
Well, I've got a long history working in health policy. Even before getting elected, I was a consultant to state and local governments and tried to help them redesign and restructure and refinance their health and human service agencies. So I've worked in this arena for a very long time, and I think I bring a pretty good experience, and I've got the ability to try to think long term. You need several things in this role. You need a backbone, you need a brain, and you need a heart. And if you can put those 3 together and never lose the balance, you're going to do okay, and I'm going to do my very best. I've got very big shoes to fill. Linda Berglund is an institution around the state Senate, and she's led Minnesota to one of the leading positions in the nation in terms of good quality, affordable health care for our residents, and it's a very proud accomplishment for her, and I look forward to working and doing my very best to fill those big shoes.
We spoke with chair of the HHS committee, Senator Hann, a bit earlier, and we talked specifically about the health insurance exchange. What role do you think the legislature should have, and the HHS committee in particular, have in developing an exchange?
Well, I think that an exchange is coming. The question is, do we allow the feds to come in and institute the national exchange, or do we have a Minnesota model? And I think there's very, very little disagreement with the basic premise that if there's going to be an exchange in Minnesota with our leading position in healthcare policy, it should be a Minnesota exchange. And so I think it's great that the governor is working hard and his administration is working hard to work with all of the interests, the healthcare interests, and look forward to working in the legislature to help craft that. You know, last year was the first year in a new world in the legislature with a new majority party. And truthfully, it was a budget year, and there wasn't a lot of time to have conversations about everything that needed to happen. And so it's not surprising that there wasn't a great deal of attention in the legislature for the exchange concept. But I think that with this additional time and going into the second year of a biennium where we won't have, we've got the budget settled, that's another whole topic. We're going to leave that one aside for right now. But I think it'll be good to get in and talk about what a Minnesota-based exchange can and should look like, because I think just about everybody understands that if there's going to be an exchange, it really should be a Minnesota one. We've worked very hard to get ourselves in a position where we have better costs and outcomes than most any other state in the country.
And Senator Hann said he hopes to begin hearings on this issue in the next few weeks. As the new lead Democrat, are you going to be ready?
Oh, absolutely. That's the first I've heard of it, but I'm absolutely. I'll come down. I just got off a farm panel here at the State Fair, and farming issues. I got the last of my hay in. I got a little cleanup to do. Got to go get it off the fields and whatnot, but that can be timed around anything. If there's hearings, I'll be there.
Okay, I want to ask you a question that was on the State Fair opinion poll. It addresses healthcare, and it's asking Minnesotans to weigh in on whether or not they believe the state should remain in control of the healthcare system or implement the federal healthcare program. How much weight will you give those results, being a part of the HHS committee?
Well, this is my first stop at the State Fair, and I haven't read the questionnaire yet, but honestly, forever, it's not a representative sample, really. It's good to take the pulse of people. Just at first blush with that question, I don't know who crafted it. It didn't sound like, number one, it's just people who step forward and fill it in. Number two, that sounded a bit leading to me. How much credibility is it going to have? I don't know. Not a terrible lot in my book. I mean, I think that what people think is very important to me. And I get out as frequently as I can and work with people, consumers of healthcare, just people. I work with hospitals, nurses, nursing homes, and do try to take a real pulse on what's happening in our communities and work hard with those interests and listen to them as they come to St. Paul and tell their stories and try to do the best that we can. But, we'll take it all and listen to it all and weigh it and do the very best we can.
Okay, Senator Laurie, my last question for you is looking ahead into the next legislative session. As a member of the minority, are there particular areas of policy that you're going to try to make public, make sure that your message is known, and perhaps work with the Republicans on getting some legislation passed?
Well, I think there's actually a real opportunity here. Last session, again, new leadership. We end a budget year. We got very consumed in the legislature with the budget. Historically, policy bills come from all of the agencies, and we typically try to keep those pretty non-controversial and just get them passed. I myself, when I was a member of the majority working under an administration of the opposite party, I took dozens of those policy bills and shepherded them through the process, kept them clean, made sure they got done. It's the nuts and bolts of running government. They're the ones administering the programs that we create, and they see what needs to be changed and tweaked, and they bring those to the legislature. They all failed this last session. We didn't even pass, as a legislature, any of the policy bills that are even non-controversial. So it's going to be a really good opportunity, I think, to sit and learn how to work together by picking up some of the policy bills that are non-controversial and just start building some of these working relationships. I've got a history of working well with my friends across the aisle and hope to draw a lot of those, draw on a lot of those relationships and start with some of those policy bills, the nuts and bolts of making the public sector work efficiently, and hopefully we can go from there on to many of the bigger ticket items.
Okay, Senator Tony Laurie, thanks so much for joining us today.
My pleasure, thank you.
We've highlighted happenings at the State Fair throughout this program, and for many, the fair signifies the end of summer and the beginning of the school year. The issue of education funding permeates many policy decisions at the Capitol. We thought this would be an appropriate time to explain to you how the school funding formula breaks down. John Brune has the answers.
Minnesota has a long history of commitment to education. The state constitution serves as the guiding force of each elected legislature, past and present, to fund an ever-changing system. Education funding is a complicated mix of federal, state, and local government dollars, often based on various formulas targeting the social, economic, and geographic backgrounds of students. This video is designed to provide a very basic overview of how education is funded in Minnesota and the role that each area of government plays in the distribution of tax dollars to school districts. Education funding in Minnesota comes from three sources: federal, state, and local government. The federal government portion makes up the smallest amount of the education pie, about 9% for fiscal year 2012-2013. Typically, a block of money is sent to the state from Washington to be used for specific purposes.
In most cases, the federal dollars get passed directly through the State Department of Education directly to school districts to pay for things like special education, community services, aid to school districts, operational costs of school districts for kids that are that come from impoverished environments. Those are pretty typical federal expenditures.
The state government portion of the education pie makes up the largest slice, about 68%.
Those are the dollars that we appropriate, as they are dollars that are the result of general taxation in the state of Minnesota. And those are the main dollars that fund the school system. Education is unique in that most of the dollars that we spend at the state level is funded directly out of the general fund. Education is the largest single portion of the general fund. It's about 40% of overall general fund expenditures. So most of what funds our state school system comes from general taxation, the sales tax, the income tax. All of those resources flow directly into the state school system.
As well as being the biggest, state government funding is also the most complex piece of the pie. Money is distributed from the state general fund to school districts based on numerous education formulas, which are designed to create a more equal or fair way of funding education.
At its basic core, a formula is a mathematical calculation without bias of generating dollars for school districts and charter schools and all schools throughout the state. So in other words, let's count the kids and multiply them times a number that we have agreed in law is how much we should give for each kid. And that's a way of allocating dollars without bias. If you didn't have formulas, you would have, then the education system would run the risk of being prone to favor among legislators. Who happens to be in power today, who happens to be in power tomorrow, and let's bias the money in one place versus the other. A formula has a way of creating a little bit of distance between the decision maker and where the dollars ultimately go. A number of legislators have talked about the notion of let's just take all the money that we have allocated to education and count all the kids and divide up the money. That's one view of what we talk a lot about in education, which is fairness. Fairness being every kid gets the same amount of dollars. But other legislators, and there's always competing interests in the legislative environment, will turn around and say, wait a second, every kid doesn't cost the same as another kid. Poverty is a factor, the ability to speak English is a factor, the distance matters. In some school districts in northern Minnesota, the distances are great and there are high costs for what we consider to be sparse school districts. All of these factors and many others tend to dictate why we need to have a variety of different formulas to deal with these differing costs. And these different formulas will reward some districts more than others. So because of these different views of fairness and the state constitution that requires us to have a fair system for every child in the state, we have different formulas to deal with those effects.
Local government funding makes up about 23% of the education pie. It consists of local levies or property taxes.
The second largest pot is the local levy, and the state does have a say in those. Ultimately, the school boards of each district has to approve the local levies, but in some cases we have formulas that are a blend of both state aid and local levy. The state aid portion is directly decided by the legislature in St. Paul. The local levies, the legislature does approve local levy authority, but ultimately it's the local school district that has to make a decision about whether to impose taxes on the property in the district.
Not all school districts have the same resources, so in some cases, local funding is enhanced with additional state dollars. One district may require more state assistance while another may need none at all. Understanding the scope of education funding is difficult to do all at once, so remember to begin with the basics. Funding comes from federal, state, and local governments. The federal government sends money to the state in one block or lump sum payment. It's then distributed directly to school districts for any number of specific purposes. Federal funds make up the smallest portion of education funding. State government is where the bulk of funding for education comes from. It's comprised of income, sales, and other tax revenue from the state general fund and is dispersed to school districts through a number of complicated formulas. The formulas are based on social, economic, and geographic variables and are designed to produce a more uniform way of funding education. Local government includes property taxes or levies decided on by school districts and local communities. Sometimes additional state dollars are blended with local levies to help particular districts around the state. For a more detailed description of public education funding in Minnesota, go to these internet sites.
This concludes another week's program. Thanks for watching Capitol Report, everybody. From all of us at Senate Media Services, I'm Julie Barkey.